Now, to help us understand this new strain of swine flu and its effect on humans, we now talk to Dr. Thea de Guzman. She is an epidemiologist from the Health Department. Good morning, Dr. de Guzman. Can you talk to us more and give us details about this new strain of swine flu, which it is said can potentially cause another pandemic?
Good morning to all. No? Swine flu is one of what we call a zoonotic disease, meaning it started off infecting just animals, but now has gained the potential to also infect humans, and and for some, even the potential to have person-to-person transmission. No? It's similar to other diseases such as Ebola or even influenza or rabies. No? And as you've mentioned, we already had this 2009 pandemic of swine flu, wherein in the Philippines, we actually had to destroy or slaughter thousands of swines, no, just to cut that transmission. No? The swine flu usually affects just swine or yung mga baboy. However, there are records of humans becoming infected, pero it's different when you say a person is infected versus a person will have the disease. Now, usually, they will just test positive for the virus, but they will often not exhibit signs or symptoms. And the usual signs and symptoms exhibited is similar to flu. No, you have fever, you could have cough or colds, or even body malaise.
All right. Now, of course, this is the big concern, no? If it becomes human-to-human transmission. But this has not yet been observed. Is this correct as far as G1 is involved?
Yeah, so there are so many numbers and acronyms connected to names of viruses of influenza. So that long G4, EA, H1N1 is the name of these new virus, and it is a relative, no? Parang it's very similar to the virus which caused the 2009 pandemic. Actually, it has been identified through animal surveillance, meaning in China or and in other countries, what they do is they test animals and identify if they have an infection. And they have been finding these G4 EAH1N1 for years. And since I think 2016, have been 35 based on an article that they have identified to be positive 35 workers. No? These are swine industry workers who tested positive for the disease. No? So far, there is no evidence that any one of these 35 who tested positive also exhibited the disease, and there is no current report that it has gained that ability to have that person to person transmission. But it's important that we have these kinds of information through surveillance so that it provides us this opportunity to prepare and ready ourselves for the possibility that it becomes or it gains that ability to have that person to person transmission.
All right. So far, the swine workers who tested positive for the virus did not actually exhibit any symptoms. Is that correct?
Yes.
All right. Now, of course, the big concern is what are the chances that this will spread to the Philippines?
It the measures being done by the Department of Agriculture is actually one of the most important measures. No, we want to prevent it entering the Philippines, much like any novel disease. No, like the coronavirus. The first thing to do is guard your points of entry, so that there will be little to no possibility of that virus entering our country. No, the information we have only strengthens the importance of us personally being prepared, and secondly, for governments to be prepared. And when I say governments, not just the health department, but in this case also the agriculture department, so that there will be no infection among swine. And by preventing that, we will also prevent any animal to human or human to human infection with this new strain of swine flu.
All right. So the key would really be to catch it at a very early stage.
Correct.
All right, thank you so much for your time this morning. That was Dr. Thea de Guzman from the DOH.